Welcome back to my channel. Hello everybody. So I know it's been a long time since I've made a video, but today I grabbed my coffee. I have no patience right now, so let's make a video. Today we're going to talk about NPs versus MDs. So that title is actually a clickbait. It is, because I really hate the NP versus MD, like they're about to fight each other. I think that all careers have something to give and something to offer in the table, be it physician assistant, nurses, nurse practitioners, doctors. Everyone has their own, like different set of skills to help with patient care. But for the purposes of this video, I want to kind of talk about what the benefits of being a nurse practitioner is and why you should be a nurse practitioner. And I'm a little biased because I am a nurse practitioner, and then so I'm going to tell you guys really why you should be one. Just a quick background, I actually am one of those people who wanted to be a doctor when I was younger. My dad is a doctor, so growing up I've always wanted to be like him. I've gone with him to the clinics, to the hospitals, and I always tell myself, I'm like, I want to be just like my dad. So when I was in the Philippines, I was actually taking pre-med classes, and my course was biology, and I was ready to just apply to med school. And then my family decided that we're gonna move to America, and that's when the plans kind of changed, and I ended up becoming a nurse because we're Filipinos. And I'm not trying to be racist or anything, but nursing is a really lucrative career at that time, especially when there was a nursing shortage. So I ended up becoming a nurse, and I don't regret it. I really don't. I love being a nurse. I love the opportunities that nursing has given me. But anyways, enough of that. Let's talk about why you should be a nurse practitioner. So I have like 5 things that I kind of jot down the other day, thinking about like, oh, why would someone be a nurse practitioner? So as you know, nursing is already a really good career, and I know a lot of people who have been nurses all their life, more than 20-30 years. So I think one of the reasons why most people get into an advanced degree is for the autonomy. So for me personally, I wanted to be more autonomous with my practice, and I want to be more autonomous with my patient care. Nurses, they carry out orders like in the hospitals and clinics. Although if you've been an experienced seasoned nurse, then you can actually tell the doctors what they should be ordering. But in general, nurses can't really prescribe medications, they can't really diagnose, they can't really start their own practice independently. So I think that's one of the things why you should be a nurse practitioner. There are actually, I don't know how many states there are right now where nurse practitioners can practice independently, meaning they can set up their own clinics without any supervision or any doctor supervising them. So California, as of right now though, we're still fighting for our autonomy in the state. Second one would have to be the flexibility, and that I think that's just money wise and also time wise. If you know that doctors do have a longer training, it's more in depth, they have more clinical hours, they have more years spent in school. Nurse practitioners, we generally need to be an RN first. But anyways, just saying that doctors, they do spend more time in school, and that's the time that you spend in school is time that you could be doing other things. And I'm not belittling you know, the sacrifices that doctors make in their lifetime to become who they are in their career field. But I wanted to travel. I really do. I wanted to travel. I wanted to enjoy the money that I'm making early on. I feel like being a doctor, it's more of like an investment, and then you get the results or you reap the rewards like later on. Whereas being a nurse practitioner or being a nurse, you're able to really enjoy the money that you're making, and you don't get to sacrifice as much time away from your family or away from the things that you enjoy doing other than med school. But kudos to everyone else who's able to do all those things while they're in, you know, residency or med school, because it's really difficult. Also, money, flexibility. As we all know, med school is very, very expensive compared to nursing school. They both cost a lot, but the amount of debt that you're gonna accrue with med school versus nursing school and nurse practitioner school is a fairly, like, it's a significant, you know, there's a significant difference. Okay, so the other thing is the opportunities of, you know, like of work after you graduate. And I know there's a lot of shortage right now, especially in primary care, and they're utilizing more advanced providers now, like physician assistants and nurse practitioners in primary care, because a lot of doctors want to specialize into something. But there's a lot of opportunities as a nurse or as a nurse practitioner. It's a very versatile, you know, career field, because you can go into any specialty. You can work in the hospital, you can work in the clinics, you can work in schools. So there's a lot of opportunities out there to be a nurse practitioner. The fourth one is why you should be a nurse practitioner is that we make good money. Nurse practitioners do make more than nurses. Although there are some nurses in different locations who makes more than some nurse practitioners, I think nurse salaries depend where you live and the experience and the specialty that you have. But I know for sure that I make more now as a nurse practitioner, because when I was a nurse here, I was making 1/3 of what I'm making now. And that's not meaning to brag or anything, but it really does make a difference if you have that advanced degree. And then the last one, and I think the most important reason of why you should be a nurse practitioner, is that because you want to be a nurse. It's just an awesome career. I love that nursing is, you know, modeled in holistic care. You look at the patient as a whole, you treat the patient as a whole, you look at them like physically, mentally, emotionally, spiritually. And I think that's a really, really important part of, you know, medicine, is you're not just treating the patient for their sickness. So I think in the end, it all depends really on your resources and how much you're willing to sacrifice, how much money you're willing to spend. But, you know, being a nurse practitioner is good, being a doctor is good, and really look into like the path leading to the career, if it's something that you're willing to partake, or if you can see yourself doing something in the future 10 years from now. I knew I wanted to take care of patients, prescribe my own medications, diagnose my patients, do a lot of patient education. And, you know, really though, if you're willing to learn, and over time, if you're, you know, really passionate about your career, I think you'll be really good at it. So those are the benefits. Those are the reasons why you should be a nurse practitioner. And I love my career. If you guys have any other questions, I'm gonna be answering some questions that you guys sent me on Instagram like later on today. Do another video for that. But yeah, so just DM me on Instagram, follow me on Instagram, subscribe to the channel. I'll be putting more content pretty soon. So yeah, have a good day, and thank you guys for watching. Let's make a video. I have my coffee and it's decaf.